learn about the relative activity of glucocorticoids. If you see relative activity of glucocorticoids, cortisol, it is once, then prednisolone, it is 4 times that of cortisol, whereas fludrocortisone, it is almost 10 times that of cortisol, whereas methylprednisolone has around 5 times that of cortisol. So cortisol has least among this list, but still we will learn even more, okay? Then even we will see relative concentration of some more drugs, okay? This I will write a good table, that is glucocorticoid activity and also mineralocorticoid activity. If you see this, first we have desoxycortisone. Desoxycortisone has 0 glucocorticoid activity. It is 100 times mineralocorticoid activity is present. Aldosterone has 0.3 glucocorticoid activity, 400 plus mineralocorticoid activity, whereas fludrocortisone, it has 10 times glucocorticoid activity and 150 times mineralocorticoid activity. Then we have triamcinolone. It has 5 times glucocorticoid activity, 0 times mineralocorticoid activity. So if you see, aldosterone are most potent mineralocorticoid activity is present in aldosterone. But the main problem in aldosterone is it cannot be used clinically. It is not used clinically. Okay, then if you were asked what is the most potent clinically used mineralocorticoids are fludrocortisone. Fludrocortisone is most potent clinically used drug with highest mineralocorticoid activity. It is the most potent clinically used drug with highest mineralocorticoid activity is fludrocortisone. Okay. Then if you were asked what is the most potent glucocorticoid, if you see, most potent glucocorticoid is dexamethasone and betamethasone is the most potent glucocorticoid is dexamethasone and betamethasone. Then what is the least? Okay, so this is important thing. Okay, next. Thank you for watching.